Hey everybody, we're going to do a quick overview of insurance as we talk about billing and coding, and we're going to actually talk about ICD-10 and different insurance forms. As we talk about that, I want to do a quick refresher just over insurance itself, because if you're going to go into billing and coding, or you're working in a position where billing and coding is important, knowing some basic things about insurance are important. So we're going to do a refresher. I know we've kind of gone over this in the past, but I just wanted to do a quick refresher, okay? So many people in the U.S., there are a lot of people in the U.S. that are uninsured, and they have to be a pay for cash. So they're responsible for all the costs of their health care. Insurance is available either government funded, state funded, employer funded, or because someone went through and bought their own health insurance. It's available. But sometimes it's unaffordable. So a lot of people who aren't ill or due to circumstances, they literally don't have any kind of health insurance. So two things happen. Either they spend an exorbitant amount of time trying to pay off these astronomical costs, or they end up being unpaid balances, which causes the cost of our health care of other people's health care to rise. And so know that when a patient comes in, sometimes places will give them a cash discount. So maybe it's a $125 doctor's visit, but they'll give them a 10% discount if they pay cash and they pay it all at one time and they don't have to make a payment plan. A lot of places do. If a service is going to be over $250 or $300 or $400, they'll let them make a payment plan to pay it out. So just know that those things are available. Many companies purchase health insurance for employees in the state of Texas, and in just about everywhere. If someone works more than 28 hours a week, they have to offer some kind of insurance to them. So that means they can offer them what was considered a catastrophic plan, which will have a really high deductible, and generally it doesn't pay anything until you meet your deductible. It has to be eligible to their dependents, which would be their children under the age of 26. Most companies, when you go to work for them, they'll have a 90-day waiting period before benefits are available. And even though they can't do pre-existing conditions, they can have a higher they either can be ineligible or they can have a longer waiting period before it'll pay on them, or they'll pay less on that. So, say someone has a is a diabetic, and they've been a diabetic a long time. They may not pay on their insulin for up to 18 months, and then they'll start paying on their insulin and diabetic related visits. So there's different kinds of insurances, and these are really important if someone is a biller or a coder, simply because you have to know whether or not that patient's insurance is going to pay when they come and see you. So HMO means health maintenance insurance or health maintenance organization. It is a type of managed care, managed medical insurance. And what managed medical insurance means is that all of the services, like you designate a family practice doctor or a family practice provider. Maybe it's a nurse practitioner, a PA, or a doctor, but that's your family physician. And then every other service that you need from them must be, it must go through an approval process from your provider all the way through the insurance company. So that means if you go see your doctor and maybe you have kidney stones and he wants you to see a nephrologist or a urologist, your doctor will have to call the insurance company to get that approved, your family practice doctor, to get that service approved before the appointment can be even made. And when that happens, sometimes it can take an extended period for them to approve it. They may want specific documentation. Many things can happen that would cause that. So you just have to be sure that if a patient does have an HMO where you're working, make sure you're in network, that you're a provided doctor, that when you look at that insurance card, it has your provider on there. And if not, just know that all services must be pre-approved. When a person chooses that HMO, it's generally a cheaper plan. But there's limited physicians that take that, and limited facilities. And what happens is, if you go to, say, you go to a hospital or to a doctor who is not pre-approved, then what's going to happen is the HMO is not going to pay any on it. All of the expense for that service is going to be paid for out of your pocket. Specialty care, like I said, they can deny it if they don't feel like it's necessary. If they feel like your kidney stone, you'll pass it, it's not too big, you don't need to have it removed, then they may deny that service, and then you can't go. Or if you do go, you have to pay for it out of pocket. So there are positives and negatives to an HMO. In a rural area like we live in, HMOs are very difficult. Many places don't take HMOs at all. And so in a larger metropolitan area like Dallas, Fort Worth, New York City, Los Angeles, big areas, you'll have more people that take an HMO, where I do know in our area, very, very few places actually, and very few hospitals accept HMO insurance. PPO is a preferred provider organization, and this is where the physician actually has a contract with that insurance company for a set amount of a set fee for their service. So even if you haven't met your deductible, the most they can charge you is what that contracted rate is. So for me, when I go to the doctor, if my deductible hasn't met, my insurance company allows $64 for an office visit, or $65 for an office visit. So until my deductible is met, I have to pay $65 every time I go and see my doctor. And then I have to pay for other services, like if it's blood work or some kind of shot or anything like that, I have to pay for those as well. But it gives me the opportunity, because mine is a PPO, it gives me the opportunity to choose any physician that's in network. So that means any doctor that is contracted with my insurance company, I can go see. And there are some things I have to get a prior authorization for, but many I don't. Also, I don't have a list of doctors that I can choose from. I can see many doctors. A lot of these come with, like I said, a co-insurance or a co-payment. A co-insurance is basically what I was talking about. An amount of money I have to pay before before my deductible is met. And a deductible is a gap of an amount of money you have to pay before your insurance starts. So a deductible is an amount of money you have to pay before insurance actually starts paying. Co-payment is if on your insurance card it says office visit $10, minor emergency visit $25, ER visit $100. That would be a copay. Now, that's a co-payment. A co-insurance means that my insurance would pay 80% and I would be responsible for 20% of that visit. So it's a percentage. Co-payment is a set amount of money, and a co-insurance would basically be a percentage. And sometimes referrals still need to be made to specialists, and they have to be made to specialists on the list that are also contracted. But with them, you'll get an in-network and an out-of-network fee. So say if I went to a nephrologist that is in network, my insurance is going to pay 80%. If I went to an out of network, they may pay 30 or 40%, and I'm responsible for the other 50 or 60% or 70% of the bill. So there is a difference. With an HMO, they don't pay anything. With a PPO, they'll just pay a smaller percent than if someone was in network. You can buy specific cancer policies, and those are there to help lots of times with high-cost treatments. Cancer treatment is very expensive. Cancer treatments can range anywhere from $10,000 to hundreds of thousands of dollars per treatment, depending on what it is. So this is in addition to your regular health insurance, but it will help supplement or pay more or help with that cap, because some insurances have a cap, like they'll only pay $1 million a year, or they may only pay $5 million lifetime for you. Well, this helps absorb some of those costs because it's a cancer-specific policy. Disability insurance, that's something that is provided. There are two kinds, are short and long-term. Short-term disability is kind of what it sounds like. It helps you take care of things for a short period of time. So sometimes people will purchase, or they will have short-term disability insurance available through their work. People use that for things like surgery, when they have a baby, some kind of accident where it's 6 months or less that they're going to be off of work. And what happens with that short-term disability is they pay a percentage of your salary to you. So if I was disabled for 6 months, they might pay me, depending on what my policy said, anywhere from 50 to about 80% of my normal weekly income. Sometimes there are waiting periods. Sometimes short-term disability doesn't start for a year or 18 months or 2 years. So you have to be sure that you're aware of what those benefits have available to you. Long-term disability generally kicks in after a year that someone has been unable to return to work. And it kind of does the same thing as short-term disability. It pays a percentage of what they make. Or it pays a certain amount, a flat fee a month or every 2 weeks or every week. And they receive that due to injury or inability to work. Vision insurance, that's where it helps pay for a portion of an eye exam, glasses, contacts, frames. It is specific to vision. You may be able to go in for an eye exam once a year. It may pay $50 on frames. You may have a deductible that you have to pay for the office visit for $10 or $15, and then you may have they may only pay $50 or $60 on your frames, and they pay so much on your lenses, and so much on your contacts. But vision insurance is specific to your eyes. A lot of insurances are HMOs and PPOs as well. So you have to just know what kind you've got, and know whether or not that person that you're going to see for vision is in network. Dental insurance, that covers teeth cleanings, fillings, x-rays, sometimes orthodontia, which would be braces, certain oral surgeries. Usually they have a deductible, they have a copay or a co-insurance, just like every other insurance. And most time they will have a cap, like a maximum amount they will pay per year related to dental work. So dental insurance, it's just as specific as it sounds, or just kind of as easy as it sounds. It is specific to your teeth. Life insurance, there's two types of life insurance. There is whole and term life. And this life insurance basically is a financial payment to your beneficiary when you die. So it could be a spouse, it could be a child, it could be an aunt, it could be a cousin, whoever you want it to be. You determine who gets your life insurance when you pass away. And it kind of varies. You can have it paid to one person. It can pay to multiple people. It could pay to your estate. It could pay to it. You determine who that life insurance goes to. Lots of times while you're working somewhere, they have life insurance. It's called term life insurance, and it's usually good for 20 years. And it will be, sometimes it's a set amount of money. Sometimes it's a certain number, it may be 1.5 times your annual salary. It could be, your annual salary. It could be 2 or 3 times your annual salary, depending on where you work. And sometimes it's just a flat fee. It's like, it could be $10,000 or $50,000 or whatever. That would be a term life policy. And individuals can also purchase term or whole life. Term life policy is for a specific number of years. And you don't actually own that policy. It's just something you pay into for so long, and then when you pass away, that money goes to your family. If you live past that window, say maybe you live till you're 95, but your window closed at 85, then after that specific age, there's no life insurance. You've passed the term of the life insurance. Whole life is a little bit different. Whole life is actually an asset to you. You pay into whole life for 20 years or however many years. And then it is your life insurance. And no matter what, they're going to pay that out to whoever you have designated. You can borrow against that life insurance. It is an asset. It is something that belongs to you, where term life insurance doesn't. Term life insurance, therefore, is much cheaper than whole life insurance. All life insurance becomes more expensive the older that you get. So if you're a young person, say you're getting out of when you graduate from college and you go to work, one of the smartest things you could do for yourself is buy yourself a whole life policy. Probably cost you $15 a month. Won't really go up as you age because you've been paying into it so long, and then you have a substantial amount of life insurance if something were to happen to you. I've already kind of talked about term life and whole life, so be sure you look at that. It's a specific amount of money that will be paid to a beneficiary. Whole life, it's a policy that allows the holder to draw on the insurance at like a pension, as well as having money to go to a beneficiary at the time of death. You can repay that money to your whole life insurance if you were to have to borrow from it. Okay, so that's just a really quick review of the different types of insurance, and depending on what you do in healthcare, all of those things may be relevant. We are going to talk more in depth about different types of insurance. We're going to talk about Medicaid and CHIPS, and we're going to talk about Medicare. We're going to talk about insurances like Blue Cross Blue Shield, United Healthcare, Cigna. These are some of the bigger insurance companies out there. Who else? Cigna, Blue Cross Blue Shield. But we're going to talk about some of those as well. And you're going to find as we talk about these, some of these kind of double dip. Some of them are private insurance as well as being a part of our Texas Medicaid program. But it's important for you to understand not only when you're working in the medical field to understand, Medicare and Medicaid, because Medicare is a law, but Medicaid is available based on income and family size. And you may have patients who may be unaware of that, and you may need to help them with that. So that's why it's important for you to understand, how those programs work and how they benefit people. The other thing that's important about understanding that is someday it might be important for you, yourself. And after we get through talking about insurances, we're going to look at specific coding and how insurance is, some steps on how insurance is billed out of a medical office. I have a niece that's a coder through McKesson. She's a third party, kind of biller that she helps make sure things get paid and that they're appropriately handled. So we're going to talk about that because there's some really neat careers. I work with a lady who is a certified coder biller, and she goes out and she educates other people. She actually works for a larger facility, and that's her job, to go and educate people within that facility about Medicare law and regulation, Medicaid changes, health insurance changes, and expectations. So there's many things you can do, and that's why we talk about coding and billing and insurance as we go along, is because there's more to healthcare that a lot of people don't know. It's not just blood, gut, sweat, taking care of, hands-on patient care. There are so many other things that go on behind the scenes that when you go to the hospital, you're not really aware of. And if those people weren't there doing those jobs and having those certifications and those abilities, people like me, the nurse working on the floor, their job, they wouldn't have a job, because the insurance and billing and coding people are just as important as the nurses, the doctors, and everywhere else, because they're the people who keep the money coming in so the doors stay open. All right, guys, I just wanted to run through that, just a refresher on insurance so we could move in and get specific about Medicaid, CHIPS, Medicare, and then private insurance, okay? All right, everybody have a good day, and I will be back with you soon. Thank you so much.